Do ear tubes stop ear infections from coming back in kids? Imagine your child constantly battling ear infections, feeling pain, and missing school. Doctors often suggest ear tubes to help, but do they really stop future infections? Let's find out. Ear infections, especially acute otitis media, are very common in children. When a child has frequent ear infections, say 3 or more in 6 months or 4 or more in a year, doctors might recommend inserting tiny tubes into the eardrum. These tubes, called tympanostomy tubes, help ventilate the middle ear and drain excess fluid. The idea is that by doing this, they can reduce the chances of infections coming back and ease discomfort. But do they fully prevent future ear infections? The answer is no. Ear tubes do not completely stop ear infections from recurring. They can, however, reduce the number and severity of infections in some children. The main goal of the tubes is to allow air into the middle ear and drain fluid that might be causing pressure and pain. This can help children feel better and improve hearing, which is important for speech and language development. Studies show that for most children, placing ear tubes does not significantly lower the total number of ear infections over a 2-year period compared to treating each infection with antibiotics as it happens. So, even with tubes, children can still get ear infections. But if an infection occurs with tubes in place, it is often easier to treat with ear drops instead of oral antibiotics. This can reduce side effects and the risk of antibiotic resistance. Besides reducing infections, ear tubes can help improve hearing by draining fluid that might be blocking sound. They can also help with balance issues and lessen pain during infections. For some children who continue to have frequent infections even after meeting criteria for tubes, the procedure can still be beneficial. Remember, ear tubes are not a cure-all. They are a tool to manage ongoing ear problems. The decision to get tubes should be made after talking with a healthcare provider, considering how often and how severe the infections are, and whether hearing or speech development is affected. In summary, ear tubes can help some children by reducing fluid buildup and sometimes decreasing how often and how badly they get ear infections. But they do not guarantee that infections will never happen again. Every child's situation is different, so the best approach is always to discuss options with a healthcare professional who can provide personalized advice based on the child's health needs.